here today from the Rural InReach program. This is our first broadcast. My name is Sarah Broadhead and I'm the project officer from the program. This is Nicole and Fiona.
Hi.
Nicole is the program coordinator and Fiona is the special projects manager. And today we're just going to have a little bit of a chat about the program and some of the things that it involves. So, guys, can you please tell me a little bit more about the program and the inspiration behind it?
Thanks, Sarah. I suppose I've had the longest time of being with the program. A little bit of information about Women's Health and Family Services. It was established in 1977 and really was about offering women and their families health and wellbeing services that looked at the whole of the woman's experience and a broad range of issues, not just physical health, looking at social, environmental, economic and biological factors. A substantial number of the clients over that time had come from rural areas, and whether they came into the clinic when they were visiting Perth, or perhaps they were ringing in to get information about some of the specialist services that are provided. However, we really couldn't provide any sort of ongoing sustainable support to these women once they went back to their own communities. As the enhancement happened with the community resource centres and that network, we saw an opportunity to be able to provide more comprehensive services that were in the right place at the right time to rural women and their families and the broader community. We do that through the increased capacity around video conferencing at the community resource centres. So the type of services that Women's Health and Family Services offer, we have medical and health service, we have alcohol and other drug service, which is around counselling and support for women and their families who are struggling with their own or others' drug and alcohol issues. We can provide support around family and domestic violence and links to other services and refuges and all those sorts of elements that can go along when someone's trying to remove themselves from that type of situation. We have mental health services, so general counselling and support around anxiety, depression, to more severe mental health issues, and working with the service providers in the community around those. We have really significant community development service, and in that we present talks around nutrition, wellbeing, which you and Janet are going to talk about later today, and we also present different topics to quite diverse community groups, so whether they maybe be new migrant community groups, people from where English isn't their first language, and they can be around health, nutrition, physical activity and exercise, a whole diverse range of talks around trauma. We also do a lot of training around for service providers in terms of responding to quite complex needs often. We have an Aboriginal family support service which grew out of supporting grandparents initially and being really aware of the kin caring that a lot of grandparents do in our community, particularly in the Aboriginal community. That's become a broader service now and supports the whole family. And we have a lot of rural clients that come through that service. And now we have the opportunity to provide these services in a rural environment. As I said, we do that through the community resource centres via video conferencing. It's really quite exciting to be able to offer services at the right time in the right place where people are already able to access a whole range of other services through that hub in the community resource centre. So.
Nicole, what kind of services exactly do you offer through the video conferencing?
Well, basically we offer health and wellbeing support, and like Fiona said, that's via video conferencing. How that's done is in two main ways. So there is opportunities for counselling, either one-on-one or couple counselling, family counselling. There's no real age restriction either. And like Fiona said, it's to women and their families, so men are able to access the service as well. Sometimes it's just for one-off information as that you know, around health and wellbeing concerns. And there also is the community talks and their community education sessions that again are through video conferencing, and the topics are chosen in consultation with the communities. So whatever is identified as a concern, whether it's an ongoing or a one-off concern, we then identify who's the best facilitator. Sometimes that's internally within Women's Health and Family Services, and like Fiona said, we have a broad scope of services that are already running within the organisation, as well as who we have within our team. And sometimes that's external facilitators, not always in the metro, sometimes they are in the rural communities themselves as well.
Okay. And I think it's really important to reiterate that it's quite a broad range of services, and that we do have really experienced counsellors. Through the video conferencing, we can provide that in a way that's really confidential. People don't have to identify why they're wanting an appointment with us, so their anonymity, their own issues are kept private. And the Community Resource Centre is somewhere that people go anyway for a variety of other reasons. So it's really easy for people to be able to just go in or ring us and make an appointment and know that their information, their privacy is kept within the way we deliver services.
What kind of resources does the program offer?
Well, we have a quarterly newsletter that goes out, and that goes to all of the partnering community resource centres as well as other service providers around WA. And in that is program information. We also invite communities to have a guest profile within the newsletter to let everyone know what's happening there in their community. And we also do running updates around the topics that are going on in the community talks, and that's the other resource that we have that goes out. I think
so that's a calendar format, the community talks.
Yeah, that's right. Yeah, and that runs for about 3 months every quarter, averaging about 2 talks per month, would you say?
Yeah.
Yeah. We also have summaries of the presenters, so it gives a little bit of an insight into who's going to be presenting, what's their background, have they had any experience in working in rural and remote communities, what their qualifications are, as well as background into what those topics are.
And people can also see those summaries and ask if perhaps there's a community group, or within that community they would like to have that presentation done again. They can look through those summaries and make a request for us to do it just with that community, or we can do it with multiple sites as well.
Yeah.
So that allows communities to ask for the workshops or have the workshops delivered again in a time that suits them.
Yeah, we're very flexible around that, and we also can record the talks themselves and have them available on our website. And that website has not only previous talks that we've had, so for example Diabetes WA did a talk for us late last year, that's up on our website. And we also have a few that are coming up in the next couple of weeks. We've got a men's health talk going up. And
conversation with Bijadanga, or is that going just?
I think that's just going to go out to Bijadanga, but that's an example of other things that we do, going and having chats with communities and giving them an opportunity to have a recording of that. That's their own personal copy. Yeah.
And there's also the Champions reference group, which really guides the program.
Yeah, it's an opportunity for representatives from the regional areas that we work with to just have a say really on what the service looks like in their community, because again that's another example I think of how we are really flexible. We don't assume that this program's going to meet everyone's needs by looking exactly the same for every community.
So we've got that reference group happens every 2 months, and so just going back around those resources, the newsletter, the community talks calendar, which also includes the different topics that we'll be doing through Westlink, the website which has lots of resources on it, it has where the different locations are, and the reference group. If people want to know more about that, they can email us and ask for that information to be sent to them directly. You can also get that information at the Community Resource Centre, and if they're interested in being part of the reference group, if health and wellbeing is really something that's really important for them and something that they would like to be contributing to in that conversation, because it's more than just about this program. It's also about what are the priority needs of rural health and remote health in WA, and how can they best be met through programs such as this, but also the services that are on the ground that we work with as well within the program. So yeah, please, you know, email us, let us know if you want to have that information directly.
Yeah, and don't feel like you don't have anything to contribute if you're not actually, you know, formally working in the area of health and wellbeing in rural and remote areas. It's actually people that just live in the communities. You know your communities better than we ever will, and that helps shape what the program Rural in Reach looks like.
Okay, so if I'd like to go about making an appointment with the program, say for a counselling session, how would I do that?
Well, you can always just give us a call on the 1800 number. Like Fiona said, we've done everything we can to ensure that accessing the program is as confidential as possible. So that's probably the best way to do it, is just call yourself. Otherwise, you can go into the Community Resource Centre that's in your area.
So the full list of those CRCs is on the website, but we've also got the list up there. So at the moment we were partnered with over 40 community resource centres, and that's continuing to expand. So there is in all regions the different centres that we're available in, and as I said, just you can go to the website and that will give you the full list. We're also working in partnership with some of the regional women's health centres, so services are available and connected to the program in Bunbury at Southwest Women's Health. We are partnered with Headland Well Women's Centre. We have working relationship with Goldfields and also in Tom Price at Nintiri. So again, all of that information you can just get off the website, the different CRCs that we're available in, and the women's health centres as well.
And alternatively, you can make a referral from the website directly if you're a service provider in any of those communities by just filling in the referral form.
Okay, so when I call to make an appointment, who might I be chatting with? Can you tell me a little bit more about who's involved in the team?
Well, the Rural in Reach team is 4 members, although we also have access to all of the other services at Women's Health and Family Services, of which there is around 70 staff. But I'm the manager of the project. My background is family therapy. I've worked in drug and alcohol and relationships counselling for over 10 years. And, but primarily within this program I manage the bigger picture, although I imagine at some point I will also be doing some counselling again through video conferencing. And then Nicole is the program coordinator. She's actually been working in Bunbury up until coming up and working in this program. She's comes from a social worker background. She's got a lot of experience in family and domestic violence and counselling with Indigenous families, particularly with their children, and then lots of community education and research experience. And then Nicole, if you wanted to talk about the rest of your team.
Yeah, well, there's Janet, and she's our health consultant, and yeah, we're really privileged to have her in the team, because not only does she have a background in family therapy, but she's also a registered nurse and midwife, so has a balance between the clinical health as well as being able to provide that emotional support, and has experience in working in alcohol and other drug counselling. And then
and is a country girl herself.
Yes,
from
that's
the
right. Yeah, so having that that insight into what it's like to live and grow up in the country, I think really informs Janet's practice. And I certainly know that my experience of living for 12 years in the southwest definitely informs my practice as well. And then we have Sarah, our project officer, who's worked in health promotion and community development, and is very passionate about youth and sexual health.
Thanks, Nicole.
That's okay.
Okay, thanks ladies. That was a really great discussion. You'll see our contact details. We open 7:30 to 7 p.m. Monday to Friday. If and we also have weekend day workshops as requested. And please give us a call or go to our website if you would like some more information about the program. And today's discussion has been really good. We've had a lot of information presented, so thank you today, and thank you everyone for listening. We'll be back shortly with a women's wellbeing discussion presented by Janet and myself.
Thank you,
Sarah.
Hello, I'm back chatting with Janet, and Janet is our Rural InReach Health Consultant, and we're both going to talk to you today about women's wellbeing. So to begin with, wellbeing, and what does it mean? So wellbeing encompasses lots of different things. It's not only about the physical health, it's also about our mental and emotional health, and also our spiritual health. So it's a holistic version of health. It's not just about what we look like or how we feel physically.
So Sarah, some of the things that are really important to take care of throughout our years as women, one of the things that we would always start with is a mammogram from the age of 50. They're every 2 years, and really important to try and follow up with those. I appreciate in the country areas you rely on the vans that visit your communities. I'd encourage you to access those. It's a really great service. The idea behind mammograms is that if they're consistently done every 2 years, they can actually pick up changes in the breast as small as a grain of sand. So even though there's some negative press around mammograms and there are other options out there, it's still being proven to be the best and most effective way of detecting breast changes. The next health check that's important around midlife, so the perimenopause, menopausal age, is cholesterol. Unfortunately, most of us have had around between 45-50 years of eating and drinking what we think is okay, and it's accumulative. So by the time we get to that age, it becomes, it can have added up. And so good idea to get a baseline test done. It's just a blood test, easy to have done, and it gives us that sort of level so that we know where we're at with that. Our blood sugar, also the same thing as a cholesterol, tends to sneak up on us a little bit. As we become older, we do tend to gain weight a little bit more and find it harder to lose it. Our normal exercise and dieting doesn't seem to help very much, so important to keep an eye on that. There's a very high incidence right now in our communities of type 2 diabetes, and so just getting your blood sugar done is a really good way of checking how you're going with that particular area of your health. Okay, so pap smears, very important for all women to be keeping an eye on what's happening with the cells in their cervix. Pap smear, people are put off by it because it can be seen as invasive and uncomfortable, but so important to have done. I know of several people who haven't had pap smears and have developed cancer at very young ages, which could have been avoided. So pap smears are recommended to begin having when you are 18 and every 2 years after that.
Yeah, that's correct. Every 2 years after the age of 18, or if you start being sexually active younger than that, I think it's recommended every 2 years after you become sexually active.
Yeah. Sexual health, big area. We're just going to do a little bit of information around that. Looking at your getting sexual screening done, so STI screening if you're sexually active. Really simple to do. You can go to a pathology lab and get that done, or go to your local GP or your health clinic as well.
Yeah, I think it's really important to stress with that one, Janet, that if an STI test does come back positive, most of the time it's really treatable. It's just a course of antibiotics, so it's nothing to be too frightened of.
Yep, that's a good point, Sarah. And also too, in our service at Women's Health and Family Services, we have a very comprehensive clinical health service with doctors and nurses, which is where I work some of the time as well. So you can always call us or email us with any queries that you have, particularly around this area, which is often a little bit sort of, you know, you want to keep it private and not let everyone know your business. Bone density, this is where it's easy for people not to be too aware of this area of their lives. Important for women in the prevention of osteoporosis, or osteopenia is the first precursor of osteoporosis. It's where the bones become very thin and brittle and are therefore more prone to fractures and breaks. Getting a bone density test done is simple. It's an X-ray and can detect whether the bones are changing. Usually it's recommended to have that done when you're coming up to the menopausal age, just so that is like the cholesterol and blood sugar. It's a baseline, so your doctor will have a really clear idea of how you're going as far as your bone health is concerned.
Sure.
And blood pressure, finally. Similar to cholesterol and blood sugar, it can creep up as well as we age. So good idea to get that done at least every 12 months, just with your doctor or your nurse, just to see how things are for you in that area of your body.
Okay, we're going to move on now to the things that we can control. And those things include our alcohol intake, so how much we drink, very important, our body weight, how much exercise we do every single day, what we eat and our diet, and whether or not we choose to smoke. So I'm going to move straight on to alcohol intake. So the harmful use of alcohol results in about 2.5 million deaths a year. So it's a very dangerous substance if it's used incorrectly. It reduces our inhibitions, so it can mean that we're more prone to having accidents. So we might get in a car and think that we're okay to drive. We might get in a car with someone else that's had a bit too much to drink, and that means there's more chances of being injured or death through having an accident. It also increases our risk of breast and bowel cancers, and it does this through increasing the cell mutations in our body, and that therefore increases our risk of cancer. And alcohol can lead to alcoholism. It's an addictive substance, and therefore it can lead to death. So, what is a safe amount of alcohol for women and men? I'm going to bring something up that I've prepared earlier. This is 100 mils, so it's one standard drink, and you can have 2 of these per day, but it is recommended that you have 3 alcohol-free days a week. So it's not much. When we fill up our wine glass, sometimes we fill it up quite close to the top, where 100 mils it's less than halfway really. So just important that if you come home from work and you have a massive glass of wine, you've probably already had your 2 standard drinks.
And that actually is a white wine glass as well. So if you like to drink your wine out of a big glass, like a red wine glass, then if you're filling that up to the top, you would be having at least 3 standard drinks a day, at least.
Yeah.
So that's pretty scary.
It is, yeah. And just bear in mind as well that a lot of the beers that are coming out at the moment, they're quite strong. They're putting the alcohol percentage up quite a bit, so usually 1 beer is over 1 standard drink as well. So make sure you check the label. By law now they have to have the amount of standard drinks on the back of a beer bottle, and that's a really easy way to check how much you're having. Question we get asked a lot at Women's Health and Family Services is, when is it okay for our teenagers to drink? The short answer to that question is that it's not okay for our teenagers to drink. Is that right, Janet?
Absolutely, yeah. There's been definite research has shown that a teenager's brain is still developing. So if they're drinking alcohol, and particularly binge drinking, which is pretty common with young people, they're actually probably destroying some of their brain cells. So the teenager's brain is still developing until they're at least 25, at least 25. So that's pretty sobering thought just on its own.
Yeah, so it's a tough one to deal with, but just try and delay it as long as possible, and remember that it's okay to say no. Nothing wrong with saying no. So moving on to diet.
Okay, diet is really important. It's not rocket science, and I'm sure that you probably have seen the food prep pyramid. Basically, a healthy diet consists of low fat, low salt and low sugar foods. A little bit of protein is good. We need protein. It does help with cell regeneration. However, we're Australians, we tend to be really big meat eaters, most of us. So what we would suggest is monitoring that and trying to cut back your protein intake, particularly your meats, to roughly about the size of your palm. So my palm size is not huge, so that's probably about the size of a small fillet steak, I guess. But that goes for chicken and fish as well. You can have a little bit more fish, but really try and cut back on those that intake. Increasing your calcium and vitamin D is important, particularly as we move forward and come up to middle ages. Calcium is important for bone health, and vitamin D is essential for calcium to be absorbed. So if you're having plenty of calcium in your diet, or you're taking supplements, but your vitamin D levels are low, then that's going to actually negate the effects of the calcium. So vitamin D is simple to check. Just have a blood test. If it's below the level of 50, then you either need supplementation with tablets, or you need to look very closely at your diet, although it is difficult to get enough vitamin D from your diet. You also need to look at your sun exposure, and 10 minutes in the sun, obviously in summer before 10 o'clock and after 3 p.m, with bare arms, so on your arms, your face and your legs, is enough to actually help convert the calcium that you are eating or taking, so that it is helpful for your bone strength and bone health. We do have brochures, Sarah, don't we, on our website?
We do, yeah, they're on our website. Yeah. They're very good, very informative.
So very, very colourful, easy to read brochures, which can be accessed from our website, and the details of that will be at the end of this presentation today. Caffeine, we all love our tea and coffee, but this includes things like Red Bull as well, and other caffeinated drinks. Green tea is full of caffeine. What else, Sarah, has got lots of caffeine
Coke,
in? Coke, big one.
Coke or normal Coke, and chocolate as well has got a bit of caffeine in.
Yeah, that's right. Yeah. So all those things. Now it's said you can have up to three doses of caffeine a day is really enough. Okay, anything over that, if you're having, for example, if you're drinking a super bottle of Coke a day, or have 6 coffees a day, then maybe it's time to look at alternatives. And that wine you saw in the wine glass is actually herbal tea. So there are some really interesting things around that you can drink as alternatives that don't have the caffeine in.
Yeah. So Janet, can you please tell me a little bit about portion size? It seems to be becoming increasingly popular when we talk about diet these days.
Sure, Sarah. Yeah. I've actually got this printout here for you to have a little look at. You can see this is actually just a plate, okay? So this would be considered to be your main meal of the day, and this is what we would recommend as a guide to portion sizing. It's a little bit different to looking at the food pyramid. The food pyramid really is an overall way to have a healthy diet throughout the whole day. So this one is looking at just one plate of food. And what we would suggest is looking at dividing your plate in half and having one half of it as fruit and vegetable salads component. The other side, dividing that half into quarters and having 1/4 with your carbohydrates, so your pasta and your grains and your rice, those sorts of foods, and the last quarter of your protein, so your fish and your meats and chickens.
Yeah, so you can apply that to different meals as well. You can also apply that to breakfast. You just have to think about it a little bit differently. So maybe having a piece of fruit for breakfast with a small bowl of cereal and a little bit of yogurt, something like that. But just remembering that, yeah, just to divide it up. Not just have one meal that's got just carbohydrates or one meal that's got just protein.
Okay, that sounds good.
Okay, so I'm going to talk now about exercise. So there are lots of benefits of exercise, and I'm going to go through those. They elevate your mood. 30 minutes of exercise a day releases lots of endorphins, and it can make you feel happier and healthier.
So Sarah, just on that
Yeah.
30 minutes, does it have to be really strenuous exercise?
It doesn't, no. It can just be a gentle to moderate walk, as long as you're going at a little bit of a pace, and that's okay. So really important to remember with exercise that we don't have to go and play sport, or you don't have to go for a run. It can just be something that's quite gentle, and it can be really enjoyable.
Great.
So exercise can help prevent cardiovascular disease, stops the heart from getting makes the heart stronger really. That's a simpler way of putting it, which means that we pump the blood around our body more efficiently, and it can also stop us from putting on too much weight. It helps to prevent type 2 diabetes, and it helps prevent osteoporosis as well. Janet, can you talk a little bit about that one for me?
Sure. Weight-bearing exercise is essential to help keep our bones strong and healthy. So, you know, for example, walking is brilliant, Pilates, yoga, dancing, fantastic. So all these things help keep our bones strong because we're actually using resistance to in those types of exercise. Yeah.
Thanks, Janet. It reduces our weight, but this has got to be in conjunction with the diet as well. So what they generally say is it's 80% diet, 20% exercise. So very important that we get our exercise, but if we want to lose a little bit of weight, we also have to look at our diet as well.
Can I just say before you move
sure.
on with that one, Sarah, that being an older woman, so you know around menopausal age, I'm finding I need to do about 50% exercise and about 50% diet. It's a lot harder to shift weight the older you get.
Yeah.
So you do really need to up your exercise around that time of your life. But you know, minimal impact, low resistance exercise is fine.
Yeah, it doesn't have to be strenuous and stressful. So exercise can also build muscles, make us stronger, make us look more toned, and it increases our self-esteem. So again, as I said earlier, it releases those natural endorphins, which can make us feel good about ourselves and can boost our self-esteem. Okay, so now we're going to move on to body weight.
Okay, so it just stands to reason, the heavier we are, the more weight we're carrying on our bodies, the higher our blood pressure will be because it's harder for our heart to pump the blood around our systems. There's an increased risk of breast cancer. Sarah, can you tell me a little bit about that? How does that fit in this?
Yeah, so if you're overweight, it can be really hard to detect breast cancers. When you put weight on, a lot of it goes around your chest area. So when they're doing a mammogram or checking for lumps, it can be really difficult to detect anything if you've got a lot of fat tissue on that area.
Okay. It's also too, our breasts become denser, so the more weight we have around our breast area, the denser they are, and dense breasts traditionally make it more difficult with mammograms, for example, to detect those changes in the breast. Now the risk of cardiovascular disease, so heart attack and strokes, obviously the more fat we have and on our bodies, the more that will contribute to the amount of what they call now toxic fat around all our vital organs. So, which then of course can lead to things like the build-up of plaque inside our arteries and also embolus, which are little, they can be blood clots, they can be fat globules that actually float around in our blood system and that can then lodge in a place that can cause severe damage, like in the brain for a stroke or in the heart for a heart attack. So I'm sure you've all seen the ads on telly recently around the toxic fat. Every time I see it, we tend to be sitting down having dinner, which is very off-putting. But it's actually a really good jogger. It really, really brings it home to me how important it is to try and shift that little bit of spreading around my tummy.
So I'm going to talk a little bit about smoking, but I'm not going to dwell on it for too long because I think we've all at least seen one of the ads once or twice. It's been a national campaign now for about 10 years, but it's a potential cancer-causing agent and it kills up to half of its users, which is about 5 million per year. It increases the risk of strokes and heart attacks and increases the risk of asthma in babies and children as well. But their message is getting out there and we are seeing a decrease now in smoking, which is great.
So Sarah, can you tell me, what are the benefits of quitting smoking?
Yeah, sure.
And how long does it take?
Yeah, I can definitely talk about those kind of things. So, after 24 hours, the level of carbon monoxide in your blood has dropped dramatically and there's more oxygen going around your bloodstream. Within 2 months, your lungs will no longer be producing extra phlegm caused by smoking. After 12 months, your increased risk of dying from heart disease is half of that of a continuing smoker. And after 15 years, your risk of a heart attack and stroke is almost the same as a person who has never smoked. So just to sum up those points, really when you quit smoking, your body does start to repair itself. So it's a great incentive to quit. And the quit line number is 13 78 48. And I'll go over that again. It's 13 78 48.
Also too, I think it's important to get the help of your health centre nurse or your doctor as well. There's an ad on TV at the moment where a guy tries several times to quit smoking, and each time he tries, he does a little better. So even if you try and you fail, it's still okay. You can pick yourself up and try again, and you'll get there.
We talk a little bit about mental and emotional health now, which is really important, isn't it, Janet?
Sure, absolutely. So we're not only looking at our physical health, but we're also looking at how we feel about ourselves as well. So it's always important to look at your balance in your life. There's a great little grid that I've got, which is online on our website, which is called the Whole of Life Grid. Basically, it's about looking at all the areas of our lives and how much effort and energy we put into them individually. So for example, if your balance is a little bit out, then it's going to affect how you feel about yourself and how you sort of respond to situations that might come into your life at different times. So if work is 80% for you, like you're at work 80% of your time, then it only leaves 20% in that grid to actually put into the rest of your life, be it family, friends, social activities, community activities. So really important to look at that and try and just tweak that so that it's a little bit more even. It's always good to look at our stress levels. Negative stress is not healthy in that it can lower our immune systems and make us susceptible to colds and flus, anything really that's going around. So if you've had a bit of a run of that, feeling unwell for quite a while, then look at what's going on in your life and see what you can do about that. Positive stress, on the other hand, is good in that it helps us get to where we need to be on time. It helps us to achieve what we want to achieve in our day. So look at those, and then of course do more of what works for you. So if something is not working, then look at how you can change that, or maybe take that out for a break for a while. Look at your relationships too. As we go through our lives, we tend to change roles and wear different hats. So good to have a look at all of those in relation to our relationships with our family, our friends, our work colleagues, people that we come across in our working and personal lives. If some of those relationships are not actually okay, then it could be time to stop and have a little look at those a bit more closer. And that's where our program can help, in that we're always here for you to give us a call or have a chat with. That's what we'd like to do.
And finally today we're going to talk a little bit about spiritual health. So that encompasses lots of different things, but it can include looking out for the vulnerable amongst us, and volunteering to help others in need, and supporting others less fortunate than ourselves.
One of the ways we can do that is to look at our skills and how we can actually give those to other people at different times. It might be volunteering, it might be offering to bake a cake for someone who's been ill, or a dinner perhaps, or something. I'm sure there are lots of ways that you already do this in your own communities. Practicing mindfulness and meditation, very important to keep us focused. There are lots of simple guides out there that you can access. There are books, CDs, DVDs. A lot of people find they get that through yoga, for example, because it is very person-centered. So, you know, you can actually get that advantage from practicing activities such as that. And then finally looking at getting some guidance from a religious leader. If that's what you like to do and that's where you find you get your focus and your stillness from, then certainly that's something that is available.
Okay, just to sum up today, we just want to go through our contact numbers. As we said, we're from Women's Health and Family Services and we're part of the Rural InReach team. You can phone 6330 5400 or the free number is 1800 998 399. Our website is ruralinreach.whfs.org.au and our email address is ruralinreach@whfs.org.au. Thank you, Janet, for joining us today for that discussion.
Thank you, Sarah.
And thanks for joining us, and we'll see you next time.